Hello, class. Welcome to Flourish Nursing Academy. This is Tutor Godwin. Let's look at the anatomy and physiology of the renal system. And Part 1 will focus on the kidney. The kidney is a paired retroperitoneal organ whose core roles are to filter blood, form urine, regulate water, electrolyte, acid-base balance, remove metabolic wastes and drugs, and perform endocrine functions: renin, erythropoietin, calcitriol. Below is a structured, detailed description of its gross anatomy, microanatomy, vascular supply, the nephron and tubular transport, mechanisms of filtration and regulation, and major physiological functions. The kidneys lie on the posterior abdominal wall, one on each side of the vertebral column, behind the peritoneum, and below the diaphragm. They extend from the level of the 12th thoracic vertebra through the 3rd lumbar vertebra, receiving some protection from the lower rib cage. The right kidney is usually lower than the left because considerable space is occupied liver. External features: convex lateral border, concave medial border with the renal hilum, entry / exit for renal artery, vein, ureter, lymphatics, nerves. Surroundings: renal capsule, tough fibrous layer, perirenal fat, gerotas, renal fascia. Internally, we have the cortex, which is the outer, granular-appearing layer containing glomeruli, proximal and distal convoluted tubules, and cortical parts of collecting ducts. Medulla, the inner region containing renal pyramids, cone-shaped. The apex of each pyramid is the papilla, which drains into a minor calyx. Renal columns, which are the cortical tissue between pyramids, columns of Bertin. Calyces and pelvis papillae drain into minor calyces, major calyces. Renal pelvis, ureter. The renal sinus is the central cavity containing the renal pelvis, vessels, and fat. Vascular anatomy and circulation: arterial supply, renal artery, segmental arteries, interlobar arteries, between pyramids, arcuate arteries, at corticomedullary. Junction: interlobular, cortical radiate, arteries, afferent arterioles, glomerular capillaries. After glomerulus, efferent arteriole. Two downstream beds depending on nephron type. Cortical nephrons. Efferent, peritubular capillaries around tubules for exchange and reabsorption. Juxtamedullary nephrons. Efferent, vasa recta, long parallel straight capillaries that descend into the medulla, crucial for countercurrent exchange and maintaining osmotic gradient. Venous drainage, capillaries, interlobular veins, arcuate veins, interlobar veins, renal vein, inferior vena cava. Typical flow values: adult, renal plasma flow, RPF, 600 mmHg, glomerular filtration rate, GFR, 90, 125 mmHg, 125 mmHg often, quoted for healthy young adults. Filtration fraction, GFR, RPF 0.2, 20%. Renal blood flow, RBF, RPF, 1 hematocrit, versus 1.0, 1.2 L-min, 20-25% of cardiac output. Nephron, structural unit, two main types: cortical nephrons, 85%, glomeruli in outer cortex, short loops of Henle, mainly perform solute and water handling, and juxtamedullary nephrons, 15%. Glomeruli near corticomedullary junction, long loops of Henle that descend deep into inner medulla, essential for urine concentration via the countercurrent system. Components of a nephron: renal corpuscle, glomerulus, tuft of capillaries, plus Bowman's glomerular capsule, parietal layer plus visceral layer of podocytes. Proximal convoluted tubule, PCT, In cortex, bulk reabsorption, loop of Henle, descending limb, thin, loop apex, ascending limb, thin then thick. Distal convoluted tubule, DCT, cortical segment receiving macula densa input. Collecting duct system, cortical collecting duct, medullary collecting duct, papillary ducts, receives multiple nephrons.